let's talk here about IBS and our considerations when somebody is coming to us with a presentation of IBS. And let's first agree on the fact that IBS is a really broad term. It's more of a description that something is irritating the bowel. It doesn't tell you anything about what is actually going on. Often, but not always, clients will come to us and they have already had some investigations done with their GP. Hopefully, if they've been suffering for a very long time, they've been seen by a gastroenterologist, but that's not always the case. Sometimes a diagnosis of IBS is made just at the GP, just based on discussing symptoms within a 10-minute appointment, but that's a conversation for another video. So we can't assume that your IBS is benign. So always, as nutritional therapists, we want to do our due diligence. We want to be looking for those red flags. We want to make sure that you're being thoroughly investigated. If you've struggled to be taken seriously by your doctor and you've not been thoroughly investigated with those investigations that your GP or your gastroenterologist could do for you, we try to help support you, and we communicate, we engage with your doctor, and we highlight those symptoms and those red flags that need to be taken seriously. But as for us, and what we can do for you is spread our net a little bit wider, because even if you have been seen by a gastroenterologist and you have had all of the tests and you've had the camera work, you had the ultrasound, you've had stool tests, you've had blood tests, and they'll be able to rule out or rule in some things. But there are other factors that they may not consider or understand. And for a lot of those cases of IBS, they fall under that category, that umbrella of those factors that were not accounted for as an underlying issue for the ongoing digestive symptoms. So without going into lots and lots of details, otherwise this video would probably last half an hour. Some of the considerations, as you can see on this page, would be, of course, SIBO, SIBO, small intestinal bacterial overgrowth. So bacterial overgrowth in the wrong place of the gastrointestinal tract, causing a lot of fermentation and gas and symptoms. What about fungus, candida? What about impaired digestion? You may not have anything that is pathological, but you may have suboptimal function, and that is causing symptoms. What about poor stomach acid? What about poor digestive enzyme output? What about some mild, sort of more subtle issues with the gallbladder, a little bit of thickening of the bile, meaning that you are not dealing with your fats really well, causing a wide range of symptoms? What about inflammation? Inflammation that, again, is not pointing towards inflammatory bowel disease, but when the stomach, when the gut is inflamed, nothing's going to work well. What about histamine? Histamine accounts for a lot of gastrointestinal symptoms. Histamine is a compound produced as part of an inflammatory response. So think inflammation, and inflammation just means the immune system is working over time. It's doing something, it's reacting or trying to deal with something. Often we see this histamine picture, and histamine can affect, again, digestion, motility, can cause symptoms in many ways. So we can see bloating, we can see loose stools, we can see heartburn, and just, stomach upset. We can see reflux. And histamine, how do you test for histamine? Your doctor is not going to be doing any testing for histamine being an underlying issue. They may have you go on a PPI, such as omeprazole. And for us, how you respond to anything that you take or anything that you tweak with the diet, again, it's all clues. If you're taking or doing something that has a positive impact, why is that? What is this having an impact on? And it helps us understand a little bit better what may be going on. And what about H. pylori, a very common bacterial infection, reducing stomach acid, causing stomach upset, stomach irritation? There is so much to take into account when dealing with IBS. But IBS in our opinion, should never be dismissed as just a non-important issue because it's so common. A problem being common does not make it okay and does not make it normal. So I would urge you to find somebody such as ourselves with the appropriate training and experience to really help you get to the bottom of your IBS. Because when you free yourself from your digestive symptoms and you're not the victim of, can I do this today? Can I wear this? How is my day going to be? Do I need to, if you're somebody who is always aware of where the nearest toilet is, if you're somebody who looks heavily pregnant by the end of the day and you're fairly sure that you're not, if you're somebody who considers passing a bowel movement once every few days is normal, even if it's been your normal for a long time, it is not normal. And in the long term, it may have some more systemic issues because pooping is your way to eliminate, clearing those toxins out of the body. So people are going to feel more toxic and uncomfortable with chronic constipation. But if you're always bloating after food, if your diet is becoming more and more restrictive and you know that there are foods that you have to avoid because of the way that they make you feel, again, that is not normal. So work with somebody to get to the bottom of it. And I hope this video helps you understand how a functional medicine practitioner may look at your IBS picture from a different angle than what you've experienced with your GP or other consultants so far.